Fantastico. Ooh. Awesome. Pomoc me? Poproszę. Zapraszamy.
Do them on both sides?
Sorry?
Yeah, him on both sides. That'll be maybe easier? Or not?
Do you know what to do if it's both
I know,
sides? Have you done it
still
before?
haven't it.
Have you done it before? Experience?
No.
No, we'll just do from the back then. It's fine.
Yeah?
Yeah. I probably won't need any help though because it's the first set.
Yeah, sound.
But we'll see.
Yeah, sound.
But you can just stand there for now. It should be okay.
Sound okay, no problem.
No hugs today.
No hugs, no hugs, yeah.
No hugs today, bro. Right, let me get this started then. Hold on. Let me. Awesome. Awesome. Here we go. Yes. Welcome back to another live lifts. Let's attack the bar. Faccione. Ooh. Come on. Yeah, nice. Fantastic. Oh, thank you. Cheers, Mihal. Thank you, mate. Woo! Ah. Welcome back to another live lifts. My name's Dr James. That was tough. Welcome back to another live lifts. Welcome to all the new subscribers and the new viewers. And if you're seeing this for the first time, thank you for tuning in. Where we lift and we learn, we review products and gyms, and we look at the evidence base for sports and exercise science, and we put the science into strength, and we do it. We don't just talk the talk, we walk the walk. And we're not trying to sell you any programs or get you on any gym fads. Just authentic live streaming, all the successes, all the failures. Oh. So welcome back, thank you. We have grown steadily in physical condition and in strength, and the channel has grown as well, which is good. So, that's the intro. What are we doing today? Hard work. We are going to just, first of all, just decompress the spine a little bit. We are doing heavy squats. Nice. Heavy squats, 162.5 on the bar. It's the second time we've done this. We did 2 by 5. No, we did 5 sets of 2 reps last time we did this. So I was pretty happy with that. That was, the only way I can describe that is perfect for this time of the season where you're increasing the weight on the bar and your volume's a little bit less, but you're doing less reps, but for more sets. So 2 reps for 5 sets. And I didn't really feel it during the session. I felt quite fresh. But I do remember that last week, for the next couple of days, I felt like my muscles weren't sore. I was growing, getting stronger, but I was just tired, like really taxing on the nervous system. And I've mentioned that quite a lot. So I feel today that this is achievable. We're doing 2 sets of 4 on this today. So that was the first set. I'll do 1 more set. But I've started to feel like, particularly on the lighter days and heavy days, light days, this is the moment where I can honestly feel that my nervous system is being absolutely bombarded. And what you might find is you'll feel super charged up, but you'll feel tired the next few days, and you might have some difficulty sleeping because your nervous system is so charged. So just pay attention to that. So what that means for me is I might have to step away from the heavy squats after I've done today's session, which is fine, and I might move on to something a bit more dynamic, like some walking lunges, or I'll do a bit more leg work in other areas. So pay attention to that. I certainly feel that now, and that is to be expected because, look, we've been going for 6 or 7 months, and we haven't had like a week break that we normally do since January. So we've pretty much been going like 12 weeks straight in this second phase. So I think we should do another set. We'll see if we can grab a spotter. Are you about to do a set, Toddy?
No.
Oh yeah. Do you reckon you could spot us? Yeah. Nice one, mate. You don't mind it filming, do you? It's all right. Yeah, sound. Not shy, are you? Nice one. So just going to do 4 reps. Yeah, it should be all right. I was looking for those colour. They'd sold out everywhere.
God, you
Yeah,
know,
they're lovely. Romalayos.
I bought these when they first came out.
Yeah, lovely they are. I got the black ones, but I was looking at those ones because they're nice.
They are.
Nice for sheer.
They
Yeah.
faded to pink. I'm too scared to wash them.
Just in case they're not quite the same. Yeah. Not quite the same. Right, here we go.
Come on.
Come on, man. Nice and natural. Nice and smooth. Nice and smooth. Breathing, breathing, breathing. Yes.
Pop up. Nice. Come on.
Come on, big breath.
Come on. Up. Yeah.
Smooth.
Come on. Keep going.
Ah. Thanks, mate. Ooh. Thanks for the encouragement. That's helpful. Very helpful. Wow. Fantastic. Wow. Stretch. So, amazing. Happy with that. That's good work. Break this down. So, I don't think I finished telling you what we were doing today. So heavy squats after we did. Well, we've had it's a fresh week, so we're due for some heavy squats again. So we're doing that today, 162. So I've jigged it round. I think last few weeks in the micro cycle we've done 3 sets of 4, 2 sets of 5, 5 sets of 2. So we've done 2 sets of 4 today, and then we'll be ready to go 165 next session. Next time we come to do heavy squats. So that's fantastic. You've got to be pleased, considering all natural, no equipment, no belts and stuff. So we're going to do some chin-ups now. So we're doing chin-ups. So it's heavy squat, light chin-ups, because the chin-ups we did heavy in the last session. We did like 132 kilo, so that's body weight plus belt and chain. So we'll hit the biceps again, hit the lats. That are just about recovered. And definitely warmed up, because I warmed up the chin-ups off screen, as usual. So that feels so refreshing. I mean, that was a really heavy taxing squat. But just by being aware of your reps, numbers, sets, and sometimes less is more. So when we come to the 165, you know, I might want to be getting out, you know, warm up. I might want to do a 1x3 next week, and then next time we do heavy squat, I might want to touch a 2x4 again, or 5x2. And you can, it's a really nice part of the season where you can play around with the amount of weight. Because remember, as I mentioned a couple of streams ago, which was tips for a deload, that stream in particular, I did mention don't underestimate the light days as well, because you're still doing a lot of volume on those light days. That's like 5 or 6 sets, and you're still pushing 140, 150. So try it, put it into practice. You guys try it and see if you can manage it, because it's bloody tough. But you get the best return on investment. Right, I need 15 kilo plate. So also, if you're joining the stream, this is March for Men as well. We are raising and promoting awareness of prostate cancer as well this month, because it's March. So as you can see, I've been wearing these t-shirts in the last few live streams. This one has shrunk a little bit, or I've grown. So we spoke about raising awareness of that, so we'll continue to have a little chat about that soon. Let's do this set now. Be nice and warm. So this is a lighter day, so we did 132 this time, so we're doing 115, because I weigh 100 and that's 15. So 15 kilos less than 48 hours ago, which I'm pretty happy with, because if we can get through a number of sets on this, it'll certainly be hitting the biceps again, and the lats and the abs. Good 6 repper. Lovely, lovely. Wow. So as I've mentioned on the channel, I don't have a donate button at the time of recording this. Of course, I'd like to raise money for Prostate Cancer UK, because they do some fantastic research there, and particularly myself as an academic doctor, they do some good stuff. And the emphasis on what I can try to see from their path they're trying to achieve is detect prostate cancer earlier in people, because it's quite curable if it's done early. The current cures that we have in terms of removal of the prostate, for instance, or if you have any kind of radiotherapy, it's not without its complications, but early detection is better. Screening, where the research is going as well. So if you do donate, you're putting your money into good causes as well. That is a good cause, and the research is fantastic. We've come a long way, but there's still 12,000 deaths a year, and 1 in 7 men as well. People at risk, such as, prostate cancer doesn't discriminate, but of course you are slightly at high risk if you've got a strong family history, or if you're black, African American, black British. So men are quite, when it comes to health, men's health is, we spoke about men's mental health, but of course men's physical health, we can things, don't we? We leave things last minute, it'll be all right, it'll go away, it'll sort itself out. But when prostate cancer is caught early, before it spread to the hips or the pelvis, your back, into the bladder, into your rectum, into your back passage, that's when the problems really start. And at that point, you know, you're beyond a cure. So getting it checked out quick and easy. Got to combine several things: examination, blood test, scan. You may be eligible for a scan, but speak to your GP or your urologist. They're going to be the experts to guide those decisions with you. But yeah, do buy the merch. I haven't got a donate button, as I said, so there's no harm in you going out and buying that way, or taking part in some of the marches that they do as well. They do a lot of activities. Lots. If you're into cycling, there's cycling. If you're into running, there's running. If you're walking, walking. There's marathons, and there's lots of events. There's a good network, and there's loads of specialist nurses as well to reach out to. So we're doing that throughout March. Get yourself checked, particularly if you're 40 with a family history, or black, or if you are 50 and you just need to get yourself an MOT of the prostate. I think we need another set. Cześć. You doing bench?
No, just press.
Shoulder press. Positive. Very positive. So also, we'll try and hit some bench press as well today. Yeah. But we'll see. We'll try. How long are you here for? Another hour or so? Half an hour-ish. Okay, that might be all right. Coming up in March, try to peak as much as we can, and then might use early April, maybe the first week of April, to do some maxing out heavy lifts, doing the squat, bench, deadlift, and we could even do chin-ups, you know. No harm in maxing out on chin-ups. Seeing what you can pull. Probably a better indicator of body strength than bench. So 4 sessions, 4 main lifts. Oh, shoulder press as well would be good. So 5. We could probably do 2 of them on the same day. I could probably do either deadlift and shoulder press, or chin and shoulder press together on the same day, and maybe squat and bench on the same day. So maybe we could do it in 2 or 3 sessions. see what we can do and start conditioning. Right, let's do another set. Good. Best one. One of the best. Yeah. Weighted, yeah. Big difference to your arms and your back. Yeah, and your abs as well. Really hits the abs. Especially with the weight pulling through, and your abs have to hold. Yeah. Stretch. Contraction. Yeah. We did heavy biceps as well. I forgot to say how am I feeling after that session? Yeah, we did narrow grip bench press, new record, 110. Then we did heavy chins, didn't we? And then bicep curls. So from the narrow grip bench press, I feel all good. Wrists felt like just a bit of a strain on them because you've got that amount of weight going through them and you're trying to stabilize the bar. Back and abs felt good. Biceps felt good. Felt a little bit of the lats today just during the warm-up, just with that initial stretch, just warming up. But now I feel absolutely fine. So yeah, I feel good. Recovery is just fantastic, honestly. So and some of you might find or question, you might want to do something like, let's say, 2 really, really heavy lifts on one day. So you might want to do like, for the back, let me know what you guys do. You might want to hit like a deadlift and a trap bar deadlift as well. Pretty heavy, for reps. And that's good. But what you'll find is you won't have, the progress is like, it's really hard to build on that because squatting in the session after, you just won't have the recovery. Your hips and your lower back just won't be ready for it. So you can, I don't know how you guys do it. You can either do it in the same day and then rest a bit longer, or find alternatives, I guess. Ooh. So we'll do for another round. So yeah, if you know somebody who's been affected by prostate cancer as well, reach out. There's lots of help available. And get yourself checked out, guys. If you've been affected as well, or know someone close to you, family member, might need a screening. yeah, it's a good cause. Their research is amazing on the website. Very nicely explained as well by the health professionals, and it's kind of, if you've caught the last two streams as well, it's how I've delivered it. It's like it needs to be delivered in kind of in layman's terms in some respects, because some of the terminology and stuff can be alienating, and it's already a scary enough thing as well to even to kind of go and get checked. Ooh. Grip is raw. Fingers feel red raw, you know. I need to look at how I'm gripping this bar. That feels a bit better. One more set, man, that's hard. Yeah. So if we do bench today, I might do some bench press, heavy bench. Essentially this stream is one of my most, I'm going to say it, but I don't really like saying it. When someone says full body workout, it really gets, you know. And people look and they go, oh, you can check my program. I'm doing a full body workout. This is what someone's prescribed to me. You know, one of these personal trainers who's given them a program. But the programs don't work unless you're on steroids. So they try to get you on steroids or some kind of thyroid medication, whatever, to mess with your endocrine system, to make you grow. So it looks like the program's working. Oh, what a naff concept. Anyway, they usually come and they go, I've got this program, I've got this app. Not everyone, but some. They go, it's a full body workout. And I'm like, yeah, how's that working out for you? It's, you know, I personally don't believe in it, because when you're doing full body workout for like bodybuilding, it's a lot, man. It's like, particularly, it's a lot of isolation, and I don't think they work in the long term. They aren't really sustainable. You kind of hit week 4 or 5 and start going, so it's diminishing returns. However, this brings me to the point, when you're doing it for strength, there's a kind of full body workout that I would say is multi-joint compound exercises, and you pretty much hit everything in 3 exercises. So yeah, kind of is a full body workout, but it's not the same. It's not the same. Squats, what we did today. Chin-ups, and then bench press. You will hit everything in one go, and you can do that in one session. No isolation work. It's sustainable. It's achievable. It's fast, and you can do that for a lot longer than you can on a conditioning program. So you can still be doing that 7, 8, 9, 10 weeks later and still be responding to it and still be growing and not feel exasperated and a bit burnt out or worn out. So I had considered that in today's stream. I was like, we could do a strength version of a full body workout, dare I say it. And that's purely coincidental how the sessions have cycled and rotated, because we did bench, chins, triceps, so narrow grip bench, chins, and biceps in the last stream. And we were due to do squats today anyway. We were due to do light chin-ups today anyway. And we're due to do heavy bench press. So it kind of just how it worked out. And I thought, full body strength, I would say. It's good. Right, this is the last set, and then we're going to warm up on the bench press. We'll try to hit some, we're up to 132 on the bench. I believe so. Right, let's do it all, and I'll demonstrate as well that if you are training from a home gym, that you can pretty much do all the exercises with a rack and a bar. Very like minimal equipment, but you probably already knew that. It's sometimes just hard to appreciate how little you need. Decline bench. Ooh. Thanks, Toddy. See you soon, mate. Yeah, nice. Okie doke. See how we're doing. Get the old pecs warmed up. Whew. I think we're all right there. Awesome. We need to get this chest warmed up. Got to be very careful. Delicate chest. Chest should be a little bit warmed up from doing the chin-ups, as are the shoulders, but not totally, particularly in some of the more stretched movements of shoulder retraction. So I'll show you for the first time I'm actually going to be doing most and some of this warm up on stream for the chest. So I'll show you some nice, not everything, but I'll show you some little bits that I'll do. These are 1.25s, these are 2.5s. So just some little stretching movements and stuff, and we've got the elastic band out as well. It's pretty useful. So if I go on this way so I don't hit anything. Essentially, this is 1.25. This is actually really, really nice as well for like shoulder work and retraction. So you've literally got your retraction element to the shoulders. And you come overhead as well. So if your shoulders are quite inflexible, as mine were a while ago, I found it really hard for the clean and jerk to get that mobility in my upper back, in my thoracic spine. So this kind of position here, very lightweight, thinking about my scapula, thinking about the shoulder girdle, shoulder control. What you can also do sometimes is you can put a towel, a roll underneath your back here, line a towel up in line with your spine. And you can lie on it, and the towel will open up your chest a little bit more. And as you're doing this wide movement, I wouldn't load up heavy on this though. As I'm doing these wide, what are they, flies? They're pec flies. This is going to tear your pec. Like, if you go heavy on it, it's ridiculous. What they don't show you, these massive bodybuilders who take the drugs, is first of all, they're on drugs, so it's easy for them because they're a bit stronger. But you're still vulnerable in this outer range when you're loaded up heavy. What they don't tell you is they lighten the load and they go for reps. But they never tell you that. They just make it look like they're going heavy. But what they do is do it for reps. If it's like 20, 25, 30, 40, whatever reps. But they lighten the load. If you look very carefully, they lighten it up. If you're doing this heavy, you're going to be getting a pec tear without doubt. And you're going to be impinging your shoulder at the top as well. Even with the 1.25, I can feel my shoulder in this position. The head of my humerus are butting up against the acromion process, because that, in this position, that joint space is closed down because I'm wide and I'm externally rotating my arms and I'm slightly abducted as well. So you've got to be really, really careful. It's a very vulnerable position. So a little bit of anatomy and thinking about your physiology. You come through all the ranges. So all the way through, it really opens up the shoulders. And you can just hold it there and think about your scapular position. Think about your control. You don't need much weight. So that's 1.25. That's pretty much 1 kilo. You can do the same with 2.5s. Don't forget your push-ups as well. Push-ups are good. Body weight push-ups, fantastico. You can hit the narrow grip on this as well. Weight the triceps up a little bit. Still feel the wrists from the other day. Oof, there's a lot of pressure going through the wrists, you know. And another one is really nice, is you can drop this down one side and press through. That opens up the pec a little bit more. Just during the warm-up, when it stops, control that end of range there. Don't let it bounce, but get that full stretch and control through the pec. It's really nice. Also, you might want to protract the shoulder as well. So your shoulders are fixed and retracted to open up the chest. But as I press through and get the top, I can protract a little bit more. That brings the serratus muscle on. Locks out the elbows, just warms everything up. Now, some of the shoulder gill will still be warm because we've just done the chin-ups, so the rotator cuff would have been working as we pull through. And I'll also get the band. There is a band here. And oh yeah, the towel, I was going to show you the towel as well, wasn't I? This is really neat actually, and the towel just provides a little bit of overpressure. You can use a roller, you know, those foam rollers that people roll their muscles out with and stuff. But I really like to use the towel because I can really get like, as if it's like a little knuckle. And it'll just open up that thoracic spine a bit more. The rollers are quite wide, you see, and it's going to hit the shoulder blades, but the towel will sneak between the shoulder blades. So if I put that there, right, grab these 2.5s. And sometimes you might feel a little pop or a crack in your back, and it's that's the facet joints of your upper thoracic spine and your lower cervical spine opening up. You see, there we go. Hold on, a little bit lower, there we go. Oh, that's right between my shoulder blades. So now, even here, I can feel my chest out a lot more. I'm getting a lot more stretch through the pec. And I come down, and I can open up opening up that chest a lot more now. Full stretch. Nice and steady. Nice and controlled. Particularly in this position, gets that extension through the thoracic spine. This hits the anterior delts as well, medial delt. That's really nice. You can even just let that weight hang. Beauty. That's helpful if you have a stiff or quite a stiff upper thoracic spine, chest. Let's get some weight on the bar. And we do a little bit with the rubber band as well. So we will be covering shoulder injuries as well. I need to do another research review and look at some of the major shoulder injuries, impingements and stuff. I think that will give some basics, particularly for this first season of streaming. Cover some of the major things. Steady warm up, man. Nice and steady. Yeah, nice and tight. Doorway stretch is always very good as well. So if you can probably see it, if I just sneak over here, quite literally doorway stretch for the chest. Like that. Really nice, really natural. Again, leaning into it. Hit the shoulders a bit as well. So I personally like to do this one, the upright row, but if you've got a shoulder impingement, you will feel this because this movement essentially is pulling your shoulder into that impinged position. So you've got to make sure you're opening that chest out, opening those shoulders out, getting those elbows high, wrists high. Shoulder as well. If you're like this, you're closing everything down, it's going to start hurting you. You've got to get those wrists up, shoulder up. This is only the red one. It's like a 1 centimeter band. So ooh. couple of reps on this 70. Yeah, I've not done a warm-up on screen, have I? Not for the heavy bench anyway. Good. Okay. Might be a little bit off there with the... It's always a difficulty when you're using this kind of setup is the bench moves around a little bit. Where to have it optimally. Ideally you want your eyes in line with the bar. That's the ideal plane. Right, let's get a little bit more on. Should go up to 100. $80, $90, $100. Do 2 or 3 sets on this heavy. Dare I say, full body workout. I've not coordinated the weights with my hat today either, before you say. It's just a coincidence, honestly. Did a stream a while ago actually. I think it's called This Will Help Your Build a Stronger, Thicker Back, Part 1. And the weights were coordinated to my outfit, like black and blue. I was like, oh, I didn't even mean that, you know. Anyway, buy the merch from Prostate Cancer UK. It's good. It's good to work out in. It's lightweight. It's good to do your activities in. I probably should have got a size up. I don't think they're pre-shrunk, so I washed it. It's got a little bit tighter, but it's all right. It's good for training in. Good to spread the message as well. Prostate cancer. It's good for March as well, but not just March though. You know, beyond. Prostates for life, not just for March. Do you know what I mean? Go and get checked. And a prostate is for life because you're also safety. You've also got to think, anybody assigned male at birth, or, you know, if you're a trans woman, they don't remove the prostate when you do gender reassignment surgery. So you've still got a prostate, so you can still get prostate cancer, even as a trans woman. Or if you're intersex or non-binary, but you're assigned male at birth. And that is on the website as well for Prostate Cancer UK. Do go and get checked, guys. And peeps. My peeps. Can we do 100? I think we can do 100 without a spotter. And then we'll be jumping up to 115 and then 130. Nice and steady. Smooth, nice. Nervous system, shoulders, get in there, good. Nice. Whew. Progress, always positive progress. Right, it's 100. How do we get to 115? We go a couple of 5s, 2.5. So you'll notice that as I'm working up through these weights, we're not doing it in pyramids as you would in bodybuilding. These are not pyramid sets, don't get mistaken. These are focused reps on getting enough charge up, getting enough warm up, but optimizing so when we reach our target weight, we've got the power to fight bench press until the death. If you've not seen that short, that was a few weeks back when we did the 125. So you see how far we've come. Did 125 and it was tough, but now, you know, we're doing 125 for reps now. So we've got 115 on here now. 5, 10, 11, 12 and a half, 13, 14, 15. Good. I'll get a spot. So I'm probably going to do 2 warm-up sets on this, as in it's kind of included now, so in the workout as well, because it's part of the volume. This weight is part of the volume. It's not a working set, but it's still warm-up, so we're hitting 115 and probably 2 to 3 reps is fine, maybe 4, we'll see. But as long as we've got to listen to how we feel at this point, you're not just like trying to like bang it out for the sake of it. Like, got to refocus, nice and steady. No bounce, don't bounce the bar, of course. Right, we'll get a spotter. Thank you for the thumbs up on the video, guys. Absolutely tremendous. We're going to grab the boys when they finish their round. But yeah, do go and get checked. And also, as I mentioned in a couple of other streams as well, with the prostate cancer, just because you have an enlarged prostate or an inflamed prostate or some of your blood tests are a bit abnormal or the GP feels a bit of a lump and bump, it doesn't always necessarily mean that it is prostate cancer. So don't get afraid either. You're still going to get checked. There's a long diagnostic pathway and it does need an expert to interpret those results, so don't be deterred. Sometimes prostate just gets bigger as we get older and it produces more of this protein called PSA as we get older. It goes up by about 3 nanograms. Is it nanograms? I forget the measurement now. It's 3 nanograms or 3 grams every year. So even someone 40 or 50 years old can still have quite a high amount of this PSA protein that they test for. It doesn't mean you've got it. It's not a diagnostic certainty. So do go and get your screening done, guys. It is Prostate Cancer Awareness Month. Yes, please, mate. Yes, please. Thank you, Mihal. So this is just the warm-up, same as usual, just help to unhook, and then, yeah. So maybe, I don't know, maybe 2 or 3 reps, 3 or 4 reps. Yeah, we'll see. We'll just see what we can do. Ooh. Ah, feeling good, feeling good, feeling good. Okay, nice and smooth.
Unhook it there.
Thank you, mate. 3, 2, 1, big lift. Yep, my bad. Yep, your ball. That's nice, mate. Nice warm up. Yeah. Are you finished now? You got?
We're gonna do legs now.
Have you?
Yeah,
Sound. Calves are just here.
Yeah, just here.
I'm going to do 2 sets, 2 or 3 sets. Can I grab you? It'll take like. Yeah, nice one, mate. Yes. So fantastic. Right, so I've lost count. 100, 15, so we take a couple of 15s, don't we? 15, 30. Let's focus, because it's very important to have the right weight on the bar. That guy was going for that world record, wasn't he? And he tore his shoulder, whatever. He didn't have the right weight on the bar. And that was down to, it's his responsibility really. You've got to check your own weights. You can't rely on the spotters because they're there to spot. It's you that's lifting it. So I always check my own weights as well, particularly when it gets heavy. So can we put, there's no other 15 plates, I'm afraid. So it's going to be a couple of greens, traffic lights. That's a positive sign, isn't it? Ready, steady, go. So there's 15, so that's 130, 70, 100, 120, 130. Yeah. All the colours. So we're going to go 132. Get some reps out. How inclusive. Rainbow. How diversified. Righto, smashing it. Oh, wow. So dare I say, the full body strength stream. Full body strength stream. It's not a full body workout. Oh. But full body strength. We did squat, we did chin-ups, we did bench. That hits everything. Three simple exercises that will hit you everywhere. Completely unintentional, but it works and it's effective. Let's get some chalk for the boys. I'm running out of chalk. Need a chalk sponsor. If anybody's watching, send me some chalk. I'll use it and review it and promote it for you. Clean streams. Every stream's a dream. Rainbow bench press. Here we go. 2-3 reps, 2-3 sets. No fail.
Hello.
Thank you very much. I appreciate it, Mihao. Thank you so much. Ah. What's up? Have you lost something?
No, this thing's for abs.
Which abs?
Or leg raises. There's like 2 bits missing. I'll show you later.
Yeah, show us later. Have you thought about the leg raises because they're
Can
good?
you put your hand into it?
Oh yeah, the arm hooks.
Yeah.
Like
yeah.
the it's like a hammock, isn't it? Like an arm hammock that you.
And these 2 bits on the top is missing.
Ah, no. Just a clip on.
Yeah, just clip it on.
Yeah, they're good, aren't they? They're really good.
Yeah.
Are you asked at reception? They might know. No.
They
No, it's difficult, isn't it? Things go missing. Maybe they got broke. Right, focus. Faccio me. Nice and smooth, yeah? Smooth, steady, calm. Let me fight as usual, but first couple of sets should be absolutely fine. Okay, nice and smooth. Okay. Okay, big lift. 3, 2, 1. Yep, my back. One. 2, 3, yep. Ah, success, progress. Thank you. 2 more. Yeah, I think I'll do 2 more. Yeah, mate. Woo! See, that's hard, but if I may say, it's not as hard as having a late diagnosis for your prostate. So that's why we're here today, to raise awareness of this as well. So if you do know somebody who's been affected by prostate cancer, so, you know, it can be quite a heavy subject, particularly if you're diagnosed late. So it's a tough thing to be diagnosed with, especially if it, you know, it's spread and it's less treatable. So early detection, guys, get yourself detected. So that's hard, but not as hard as having, you know, coming to terms with something that is potentially treatable if caught early. So reach out. There's lots of specialist nurses, and if you're afraid or not sure to go and get tested, there's a really nice form on the website that you can fill out as well, asking about signs and symptoms, asking about your treatment choices and options as well, and your preferred methods, and have a chat with your healthcare provider, see what investigations they want to do. You might need a scan, or you might need a finger test. They might check your back passage, or they might check your blood. They might give you an MRI scan, ultrasound, you know. So there's lots of options available. But buy the merch, please. If you don't feel like donating cash, not everybody's comfortable giving cash, are they? But if you can get some of the merch, they've got lots of different things for all sports. There's cycling tops, standard t-shirts, there's hats, there's long sleeve walking jumpers, hiking jumpers, woolly hoodies, zip up hoodies, and then mugs and badges and pins and scarves and stuff and hats. So, but buy the merch as well, because it's very, very, very good cause. That, as I say, myself as an academic and looking at some of the research that they've done and the progress, even the progress they've made within the last 10 years is absolutely outstanding. So, yeah. Maybe go as a group. That's a good idea, isn't it? Don't know. Do men do that? Would blokes do that? Would they? Don't know. Would they all go and get checked together? Probably not. It's just that men are classically not great at going for health checkups, are they? And maybe it's something they do as boys together. You know, if you're good enough to go down the pub and do stuff and celebrate, then you've got to raise and look out for each other as well. And that goes back to a story of a friend of mine who was chatting to his brother, and only because he was with his group of mates and his brother, he said to him, "Have you had your prostate checked? Because I've just been diagnosed with prostate cancer and it's far too late for me. I've lost a lot of weight and it's spread." And that was when his brother turned around and went, "I've lost weight as well, you know," and they're about a similar age. And then he had to go and get checked, and unfortunately it was already spread to the bones. So you've got to talk to each other as well about these things and raise the awareness. It'd be fantastic. It's one of the, in fact, so we screen for cervical cancer, like ladies' vaginal cancers. We screen for breast. We screen for bowel, colon cancer. Lung cancer we screen for as well. But we don't screen for prostate cancer. Partly down to some of the inaccuracies in the test. It's quite hard to interpret some of them. But hopefully that can become something that can be routine. We can standardise. Maybe it's hard to do, but we've got to justify it with research and an evidence base of, let's say, a certain age group or population of people will be screened. And what we don't want is lots of test results showing that you've got a problem with your prostate that could be cancerous, but actually it's not. We've got to try and cut that number down so it's much more accurate. So if the test says that you have it, you actually do have it. That's the ideal scenario that we want. But at the moment, there's a lot of controversy around the interpretation of some of the results. So let's do another set. But thank you for tuning in for this awareness stream. Let's do some bench. Wait for me how to finish this set. But yeah, it's a good cause, as always. We did the no smoking stream, the Stoptober, a while back. And there's lots of other good streams and causes that I want to do and raise awareness of. So it's good. Let's do another set. Come on. I think it's better without the hooks, though. Do you not think?
Yeah.
Because I think it hit the lats a bit more. Do you mind if I have a spot off you? I think that hits the, because when you got your arm in those hooks to do the leg raises, I think it hits the long head of triceps a little bit,
Yeah.
and it's quite vulnerable there, isn't it? But if you're hanging just from the bar, it hits all your arm and shoulder and your lats. That's what I think. I find it puts a lot of pressure. Sorry.
Is that good or not?
Well, I think that the long head of triceps, if you're most of the time, if you're going to injure your tricep, it's probably going to be the long head that ruptures off.
Yeah. Well, you think it's better with these hooks? Yeah?
I find it a bit better without the hooks, to be honest.
Without,
Yeah, I do. Yeah, just because I think it engages your shoulders a bit more and your lats and your core.
Yeah.
A bit more stress through the spine rather than
I think
through the
they always
tricep.
got bad shoulder after that.
After doing without the hooks.
Yeah.
Yeah. So that's interesting. You've got to do what works for you. Right. Okay. Same again, mate. Yeah.
Yeah.
Fantastico. Okay. Three, two, one. Yep. Smooth, baby. Yes.
So,
Yeah, that feels
it's
fantastic.
very uncomfortable, man.
What's uncomfortable?
I need to lift it.
The height.
Lift, yeah.
Is it too low or too high, you mean?
Yeah.
Do you want to stand? Do you want to stand on a disc? Yeah. Yeah. Stand on a block. Yeah. That's the thing with using different benches. Different gyms you go in, different bench presses, different setups. You always have a discrepancy between the hooks and the bench and the bar and where you are. So pay special attention to that because you don't want to be off kilter. But that felt really smooth. No bouncing. Oh, fantastic. Wow. One more set, then we'll debrief. Got the old banana. Yeah, I ran out of bananas, didn't I? But we got new bananas now. Stocked up. Ooh. Yeah. Right, that was fantastic. Full body strength stream. Try it. Do mega heavy squats. Chin-ups. Loaded, weighted. Then hit the bench. Because you think about it, you've got bench, pecs, anterior delt, shoulders, triceps. Chin-ups. Arms, forearms, biceps, rotator cuff. Medial delt. Posterior delt, rotator cuff. Lats, rhomboids, traps. Abs. And then squats are going to hit lats, erector spinae, quadratus lumborum, rhomboids, glutes, abs, transversus, abdominis, obliques, quads, hams, hip, internal, external rotators, glute median, yeah, amazing. Calves as well, a little bit, yeah. It's going to hit a bit the calves. If you squat enough for a long enough period of time, you will actually feel your calves working. But of course, if you're doing it for only a few reps, you won't feel it. But if you do keep squatting, you will feel your calves working. Ground force. Right, Right, last set coming up, then I will. I'll do one more set now. Takes a lot of focus. I think that's 3 minutes. 3 more reps. Finish on a positive. Okie doke. Yes, please, mate. Let's get me half back. Valcic. Three. Grip the ball. Yep. Nice and smooth. Okay. 3, 2, 1. Three. Yep. Yes. Nice one, mate. Yeah. Fantastic. Wow. Thanks, mate. Appreciate that.
No problem.
Success.
You done now?
Yeah.
So,
That is a successful session with everything. But let's debrief, because there's no point in you just idly watching me take weights off a bar. I can always do that afterwards. Right, so fantastic. Righto, awesome. So thank you for joining another live stream. Oh, that was good. What did we do? We did very heavy squats. We did 162.5, and we did 2 sets of 4 reps. Pretty good. Considering last time we did heavy squats, we did 5 sets of 2 reps. So you can see how we've switched it, tailored it. So I might have done 10 reps spread out last time, but now I've done 8 reps in continuity over 2 sets. Pretty good. That's how it works. So then next time I'm going to jump up to 165, and then I might shock the body again, and I might do 3x3, 4x3. We'll just see. Then we did chin-ups, light chin-ups. So we did 115 kilos, because I weigh about 100 kilo. We had a 15 kilo weight plate on the belt. Bearing in mind we did very heavy chin-ups 2 days ago, 48 hours ago, and we did 132 kilo chin-up for reps. So that's really, really good. And then we did bicep curls as well. So we've hit the back and biceps again today, but again, like more covertly, a little bit lighter, but it was good. And then we did heavy bench as well. 132 on the bench, pretty good. We did 3x3. Fantastic. Every session just breaking records now. But that's how it should be. Like, every session you should be like, you should be, you know, still completing all your reps or your sets, but it's challenging. But I'm hitting new numbers every single session. Every single session I'm hitting new numbers, or new, you know, you're getting out more reps, do you know what I mean? So do tune in again to see more progress. This is the first time we've done 132 on the bench, so, oh, my tricep. Because we did narrow grip bench press, 110 kilo 2 days ago. So this is where you feel your triceps like waking up again. So we'll do 132 kilos again next time we do heavy bench. And we might be able to do a 3x5 next time. Or we might be able to do a 4x4 on 132. We will be stronger either way. Our body would have responded. And that's it. So there's like a full body strength stream. Yeah, not a full body workout. Full body strength stream. Your squats, your chins, your bench. Absolutely brilliant. Perfect to hit everything. Brilliant. So thank you for joining. We are coming to the end of strength season. So I'll be doing this for another couple of weeks through March. Maybe until early April, we'll max out, and that's it. I think the body of work is complete. And I need to review shoulder injuries and shoulder pain. And I think I've pretty much covered most of the main things that I want to, either through looking at research articles or in basic discussions throughout the streams. So, and then I'll break off for the summer and I'll do loads of conditioning because I'm really happy with the size that I've built. I've put on 7 kilos in 7 months, so I'm pretty happy. And my clothes don't fit me anymore, so it's about time, isn't it? Right, anyway, thank you for joining the stream. Thank you for watching live lifts. If you're catching this live or on catch up, I do appreciate it. And it's just a guy having fun, doing what he loves. Just teaching, education, lifting heavy weights. So appreciate it. And do you know what? The most important thing is, even after today's session, that was heavy bench and it was heavy squat and it was really challenging for the chin-ups after doing it a couple of days ago. I still feel fresh, and that's what I mean. You shouldn't be leaving the session. Some sessions I'm completely worn out because I've been doing some of the cardio and functional stuff with the sled. But I feel fresh, man. You honestly feel like you could do it again. You couldn't, but you do feel like you could. So anyway, that's it. Right, enough waffling from me. Thank you very much for joining in and watching. Do let me know how your training's going. I appreciate it. See you later.